Welcome to another Inside Lyme Podcast. You are listening to a show dedicated to discussing actual cases. Dr. Daniel Cameron has been treating adolescents and adults for more than 30 years. He feels that the best way to get to know Lyme disease is through reviewed actual cases. Please remember that the advice given is general and not intended as specific advice as to any particular patient. If you require specific advice, then please seek that advice from an experienced professional. Now please welcome Dr. Daniel Cameron.
Welcome to an Inside Lyme case study. I am Dr. Daniel Cameron. I will be discussing two mothers who transmitted Babesia to their babies. Saetre and colleagues first described these cases in the Journal of the Pediatric Infectious Disease Society in 2017. Babesia is caused by a parasite called Babesia microti. Babesia can be transmitted from the bite of a deer tick, a blood transfusion, or during pregnancy. In this case study, Babesia was contracted from their mother. I discussed this paper from the baby's perspective in an earlier Inside Lyme podcast titled Two Children Who Contracted Babesia from Their Mothers. In this podcast, I will be focusing on the mother's perspective. The first mother lived in Westchester County, New York, an area endemic for Lyme disease. I live and practice medicine in the same county. The mother was diagnosed with Lyme disease in her third trimester at 32 weeks gestation. She presented with an erythema migrans rash. She was treated with amoxicillin. I use amoxicillin for pregnant women in my practice. I use other antibiotics such as azithromycin. I work with my patients' obstetrician as needed. I advise my patients to return for follow-up to ensure their Lyme disease has been successfully treated and to reassess for evidence of Ehrlichia anaplasmosis or Babesia. The doctors followed the mother. The mother was positive for Babesia by IgM laboratory testing 2 weeks after her diagnosis of Lyme disease. A positive IgM test would be consistent with an early infection of Babesia. I would have treated the mother for Babesia. The mother was not treated for Babesia. The mother and her baby boy went home. The mother's baby boy was diagnosed and treated for Babesia 4.5 weeks after going home. The mother was again positive for Babesia. The tests were now positive for Babesia by an IgG Western blot. The conversion from a positive IgM Western blot test to a positive IgG Western blot test was further evidence that the mother contracted Babesia during her third trimester. I would still have treated the mother for Babesia. Again, the mother was not treated for Babesia. The second mother lived in Putnam County, New York, an area endemic for Lyme disease. Putnam County is located just north of Westchester County. The mother initially had muscle soreness and a fever for 2 weeks. The mother was diagnosed with Lyme disease in her third trimester at 37 weeks gestation. She presented with an EM rash. She was treated with amoxicillin. The mother's laboratory test for Tick-Borne infection was not positive at the time of her EM rash. Her baby girl was tested for Babesia after delivery. Her girl's blood test was positive for Babesia microti by PCR. The doctors did not look for Babesia in the red blood cells under the microscope. The doctors concluded that the baby girl showed no symptoms. The mother and the baby girl went home. Neither were treated for Babesia. Her girl had evidence of Babesia in her red blood cells when she was 18 days old. Her girl was hospitalized and treated with a series of antibiotics, anti-parasite medicines, and a blood transfusion. The mother's blood tests were now positive for Babesia by PCR, which is a DNA test, and IgG and IgM tests. The conversion from a positive IgM Western blot to a positive IgG Western blot test was further evidence that the mother contracted Babesia during her third trimester. The mother was not treated for Babesia. The girl was. What can we learn from these cases? Women can contract Babesia during their pregnancy. Pregnant mothers with Babesia can transmit Babesia to their babies in utero. There can be a delay in the onset of Babesia after contracting Lyme disease. In these cases, the Babesia occurred weeks after the mother contracted Lyme disease. The delay in onset should prompt doctors to follow a mother and their child for evidence of Babesia. What questions do these cases raise? How often do mothers contract Babesia during their pregnancy from a tick bite? Should doctors follow pregnant mothers with a tick bite or Lyme disease for Babesia? Is there an effective and safe treatment for Babesia for a pregnant woman? How does a mother or doctor recognize Babesia in a pregnant mother? Should the two mothers have been treated for Babesia? Will the mothers develop complications of Babesia in the future if not treated? Many patients are complex, as highlighted in this Inside Lyme podcast series. I have been asked about the risk of contracting a tick-borne illness during pregnancy. These cases highlight the difficulties when counseling mothers if they're bitten by a tick or contract Lyme disease during their pregnancy. We need more doctors with skills diagnosing and treating Babesia in children and their mothers. We need to determine the best course of treatment for pregnant women and their children. We hope that if a professional sees a pregnant woman with a tick-borne illness, that they can use these cases to remind them to look for Babesia and treat accordingly.
Thank you for listening to another Inside Lyme podcast, a show dedicated to discussing actual cases. Keep in mind, the notes for this episode and all episodes can be found on our website at danielcameronmd.com. Sign up for our newsletter to keep up with our cases. As always, it is your likes, comments, and shares that help spread the word about this podcast and our work. If you can, please leave a review on iTunes or wherever else you get your podcasts. Until next time on Inside Lyme.